So good afternoon. I'm Dr. Dale Bratzler. I'm the Enterprise Chief Quality Officer here at OU Health and also the university's Chief COVID Officer. I'm going to provide a brief update on where we're at in the pandemic here in Oklahoma. I have a lot of good news to share this week, which I'm really happy about. And then I want to talk about a few things that are happening going forward, and explicitly I want to make sure that everybody understands that despite the fact that we do have some very good news right now, I want everybody to maintain their vigilance to prevent ongoing spread of this particular disease. So 1 week ago, I was here and I talked about the fact that Oklahoma was third in the nation in terms of the population incidence of new cases of COVID-19. At that time, 1 week ago, there were 103 new cases per 100,000 population per day in Oklahoma. I'm happy to say that as of today, we're 10th in the nation now with respect to the number of new cases, and we're down to 67 new cases per 100,000 per day, which is a dramatic drop in the number of cases. Nationwide, there's been about a 10% reduction in the total number of cases in the past week or so in the United States, with decreased hospitalizations nationwide also. So it appears that we're certainly past the holiday surge. Numbers are coming down. I think that's really good news. Today, the State Health Department reported 2,946 new cases. Sadly, 47 more deaths were reported today. I'll talk more about deaths in just a moment. We're up to 3,187 Oklahomans that have lost their life in this particular pandemic. In the handout that I've sent out, one of the things that you will notice is that the 7-day rolling average of new cases today is at 2,564. I just want to highlight that 9 days ago, we were at 4,256. So as of today, that's a 40% reduction in the number of new cases on average daily in the state of Oklahoma. A dramatic drop, much greater than has been seen around other parts of the country. If you look at rural spread of the disease, it still predominates, although the numbers are way down. So Alfalfa County still has the most cases in Oklahoma per population, 120 per 100,000 population, but 120 is dramatically lower than they were just a few weeks ago. So it seems to be across the entire state that we're seeing a reduction in the total number of cases by population. So I've seen several social media posts recently that have suggested, well, we're just not doing as many tests. And indeed, we're not doing as many tests as we were. So far this week, the results of only 82,000 tests have actually been reported. But if the case count was going down because we weren't doing enough tests, I would expect the percent of the tests that are positive to be higher. Typically, when the total number of tests go down, the percent of those tests that are positive go up because people who are sick going to emergency rooms, urgent care centers, and hospitals are the ones who get tested. But indeed, that's not what's happening. So the other piece of good news is that the percent positivity has come way down. So 3 weeks ago, the percent of specimens in the state that were tested that were positive was 19.1%. So far this week, it's 10.2%. So again, another bit of evidence that we're seeing a real improvement in Oklahoma, not only a reduction in the total case counts, but also a reduction in the percent to positivity. And then indeed we can continue with the fact that hospitalizations are down in the state. As of yesterday, there were 1,634 people in the hospital. On January 5th, we had 1,994 people in the hospital. So that's 360 fewer people that are in the hospital today than were on January 5th. Now I know there's been discussion about moving patients to some alternative settings, but it's not 360 patients. So we've seen a reduction in the total case counts, 40% in the past 9 days. We've seen the percent of tests that are positive come way down, and we've seen the number of people in the hospital come down. So that tells me that the numbers are real. We're seeing a real reduction in the total number of cases in Oklahoma. One point I did want to make, I know there's a lot of concern in the past 1 week. I believe we've seen more than 220 deaths in our state from COVID-19, and so there's been a lot of concern about the high number of deaths. But remember, just a few weeks ago, we had 500 people with COVID-19 in intensive care unit. Deaths always are delayed after cases are high. Remember that patients who are in the hospital in an intensive care unit bed have a much higher mortality from COVID-19. So as of today, yesterday, we still had 438 people in the intensive care unit. So, sadly, those are very ill patients, and we'll probably continue to see deaths for some time, but deaths will lag behind hospitalizations and total cases. Finally, I just put in one bit of news in the handout this week, and it just came out yesterday. The Centers for Disease Control came out with some new recommendations. I know that people that are getting the vaccines, both Pfizer and Moderna, sometimes have difficulty getting back in for that second dose when they were asked to do so. CDC changed their guidance yesterday and said that you can wait up to 6 weeks after your first dose to get the second dose, which gives you a much bigger window of opportunity to get the dose of the vaccine. So that's very, very important. That was new news this week. So some good news. Again, I want to highlight again, we can't let our guard down now. Universities are all opening this coming week. Many school districts are back in session, so we need to be very cautious about, we could see a bounce back in new cases if we don't continue our vigilance, maintain masks, physical distancing, and hand hygiene. So I'll answer questions.
When you were talking about the 6 weeks that you can wait now, I know that there have been some instances, my daughter was an example, as soon as she got the vaccine, she caught COVID or tested positive for COVID, which is probably just coincidental, I'm sure, but the fact that having that extra time for some of those people, because they still need to get their second dose, even if they get vaccine and then get COVID.
Yeah, so it's a really good question and a common one. So somebody gets their first dose of the COVID vaccine, and then within a week or so, they test positive for COVID-19. Remember, you cannot get COVID from this vaccine, and second, this vaccine cannot cause a positive test. So it's coincidental, as you highlight, that the person was probably exposed to COVID-19 either just before they got the vaccine or shortly after they got the vaccine. Remember, you have virtually no additional immunity to COVID-19 until at least 10 to 14 days after you've gotten that first dose. So you can still get COVID-19. The current recommendation is that you don't get a second dose of the COVID vaccine until you've completely recovered from COVID if you have the infection, and that you're completely beyond the isolation or quarantine period of time. And so this does allow a much bigger window out to 6 weeks after the first dose to get the second dose of the vaccine, so that you don't have to be vaccinated too soon after you've had your first dose of the vaccine. The CDC has pointed out before, there is no maximum interval between first dose and second dose. So if you've had COVID-19, there's a pretty good chance you're immune for at least some period of time, 90 days. There are some studies that suggest up to 6 months. So you can delay the vaccine after you've recovered from COVID-19.
Let's jump in. We've got a lot of questions today. The first one was from Tyler at Channel 8 in Tulsa, and he was wondering about double masking and research that was out there that whether or not it's worth wearing 2 instead of 1. Does it make a difference?
Yeah, so the question is about whether you should wear a double mask. And in fact, we do have some healthcare workers that do so fairly routinely, perhaps wearing some type of a cloth mask with a surgical mask over it or underneath it to increase the filtration. We know in the general public, but not in healthcare settings, but in the general public, if both parties are wearing even just a cloth mask, it dramatically reduces the possibility of transmission from one person to another, because you have both source control, stopping those droplets from coming out of your mouth that get into the air around you that somebody else could breathe in, and then if you happen to be the other person and you're wearing a mask, you're less likely to breathe in those droplets. So simple 2-3 layer cloth masks have been shown to be quite effective at blocking droplet transmission of the virus, particularly when both parties are wearing a mask. In healthcare, we typically are closer to people. They may be infected. Remember, a good proportion of the people who get COVID have no symptoms, so we don't know whether they're infected or not. So we typically wear higher quality mask. Certainly if we're doing certain types of aerosolizing procedures, we wear N95. We may wear something called KN95, which may provide some additional protection, or the type of surgical mask that I'm wearing right now. They're all very effective. But if you wear 2 masks, you will increase filtration and you may decrease the amount of droplets that you can inhale. So there's nothing wrong with it. I'm not aware of specific research that's quantitated the reduction in risk from wearing 2 masks, but there's nothing wrong with doing it.
So Tevis at Channel 9 was asking if you could review the traveling orders put into place and how we think that will affect the spread of COVID-19.
Yeah, so the Biden administration released their COVID-19 plan. It's a couple of hundred pages long, so I've not gone through all the detail. But I know some of the provisions specifically related to travel was the president has ordered that we wear masks in public transportation, and that included obviously airplanes and commercial aviation, but also included buses, trains, commercial maritime types of transportation. So requiring masks in those settings where you have multiple people inside of a vehicle, whether a bus, a train, an airplane, those types of things. The second thing is that they have, I think, mandated now that if you're an international traveler coming into the United States, you have to show proof of a negative COVID test before you can come into the United States. So those are the 2 key provisions. I know they also directed the CDC to look at policy and see if there are other things that we should do to make travel safer.
But still, is this maybe a good time to say that it's still the best is probably still just getting in your car and somebody?
Yeah, I mean, anytime you get inside of a closed space with multiple people, you increase the risk of transmission of COVID-19. You know, the airline industry, I think, has done a good job of making the airlines as safe as they can by requiring masks, by improving filtration using HEPA filters and other things. But if you're on a plane and you're taking your mask off to drink a beverage or something, and other people are doing it, there is some chance of transmission. So the smaller group you're in, the safer you'll be. Just remember, any indoor setting where people aren't wearing masks increases your risk of transmission of the virus.
Okay. Let's spend a little bit of time on the variant because a lot of people ask me about that. Jacqueline wants to just have you kind of go over what does it mean to Oklahoma? Do we assume it's here? Could this make more cases? Could that make the cases rise again?
Yeah, so it's a real great question about the variant strains of SARS-CoV-2, the virus that causes COVID-19. So the one that's been most discussed is the UK variant, initially found in the south of England, which is spreading very rapidly. That particular variant virus has about 20 mutations, some of which affect the spike protein, that protein on the surface of the virus that attaches to the human body, to the human receptors. Because of those mutations, that virus appears to be more contagious. It spreads up to 50 to 70% more efficiently than the variants that we've been dealing with over the past number of months. So it spreads faster, and a number of countries, particularly in Europe, have noted increasing transmission rates because of that. This particular variant strain is in the United States. It's been identified, I believe, in 20 states now, but I have to tell you that I'm just assuming that it is in Oklahoma. I know it's in Colorado, it's in Texas, it's in New Mexico. There is absolutely no reason to think that the variant strain of COVID-19, the virus, is not in Oklahoma also. It doesn't appear to be more virulent. In other words, it doesn't increase the death rate or severity of illness. However, it spreads more easily, which could increase the case count. And remember, in Oklahoma, typically 10 to 12% of confirmed cases will end up in a hospital, so that if we saw rapid spread of this variant strain with new cases, we could potentially see more people end up in the hospital. So it's why I said at the outset of my comments, this simply is not the time to let our guard down. Even though the numbers look better right now, we just need to remember there may be increased spread of a variant strain before long, and there are multiple things that are happening now that are bringing universities, school children, and others back together, which could increase some of the spread.
So maybe I missed it. Are we testing for it specifically yet in Oklahoma?
Yeah, so the testing is very specific genotyping that has to occur, and the CDC is now taking specimens from all laboratories in all states and testing for the variant. So to the best of my knowledge, we've not had a confirmed positive variant, test in Oklahoma yet, but again, it's impossible to stop a virus like that from crossing state lines. So I think it's pretty likely it's probably here. We just haven't identified it yet.
And so another reporter's asking about the treatment and if the vaccine will work.
Yeah, so there's good news. There were 2 papers that were published in pre-peer review form this week that looked at the vaccines and the variant strain, the UK variant specifically, and it appears that despite the fact that there's mutations of the spike protein, and remember the vaccines that we use create antibodies against the spike protein, but it appears that people who get the vaccine very robustly develop antibodies and also T-cell immunity, the type of immunity that lasts much longer, and it still appears to be effective against the variant strains. There are some concerns. There are other variants around the world that may not be quite the same. There's one in Brazil, for instance, right now that people are a bit worried about because it seems that in Brazil they've documented a few people who had recovered from COVID-19 and then were infected with this second variant strain. So we just have to maintain our vigilance right now.
All right, let's talk about the hospitalizations. Overall, it looks like we're seeing some good news in those numbers, which we talked about a little bit earlier. Just maybe a little bit more, do we feel like that's good news we can
Yeah,
bank
so
on?
yeah, so the good news is hospitalizations have come down from their peak. I think I mentioned about 360 fewer people in the hospital today than there were on January 5th, which has created a bit of breathing room for hospitals, opened up some ICU beds and others, but we still have more than 1,600 people filling our hospitals with COVID-19. So again, I think our healthcare workers are breathing a bit of sigh of relief, but they're still very, very busy, and we need to remain vigilant. Preventing spread of the virus is the most effective way to reduce hospitalizations. One of the points I will make, and part of the reason that we're very actively promoting vaccine to people that are 65 years of age and older, is that they account for 73% of the people in Oklahoma with COVID who end up in the hospital. So it's a very important age group to get vaccinated because they're nearly 3/4 of the cases in the state that end up in the hospital.
Let's talk about flu. In the years past, how do the numbers comparing this year to the years past, and have COVID-19 precautions impacted the flu rates?
Well, so the question is about influenza and what are we seeing right now. So in the United States, I looked at the CDC map earlier this week. Most of the country is still fairly green with respect to very low rates of transmission of influenza. We're all happy about that because we were quite concerned about if we had a surge of influenza at the same time we were having a surge of COVID-19, we could overwhelm our hospitals easily. The good news is that hasn't happened. If you look at history in Oklahoma, January is the most common month for outbreaks of influenza in Oklahoma. So we're almost through January and we haven't seen big peaks. Influenza can occur anywhere all the way out through March. So we're certainly not done with flu season, but the good news is the case counts appear to be very low. Hospitalizations from influenza appear to be very low, and we've known for quite some time with things like wearing a mask, doing hand hygiene, certainly physical distancing, Influenza is a respiratory virus just as COVID-19, the virus SARS-CoV-2 is. And so those interventions that we're doing for COVID-19 definitely can have an impact on reducing the rates of transmission of influenza.
So can you have both at one time?
Yes, there are well-documented cases where people have been infected with both influenza and COVID-19. We actually learned that early in the pandemic from places like Seattle that were having a lot of the early cases because their early cases were occurring during flu season. So there were definitely cases where people had both infections at the same time.
So could the fact be that we're just only testing people for COVID and not for flu?
Well, I think, so the question is, are we just testing for COVID and not the flu? And I think most people actually, most emergency rooms, urgent care centers and others are still testing for influenza. I haven't looked at the actual number of influenza tests that are being run, but it's a very easy test to do. And many laboratories now have developed a single swab that will test for both COVID-19 and for influenza. So I don't think it's because we're not testing enough. There just doesn't appear to be as many cases of influenza and RSV in children. We're not seeing nearly the volume of RSV that we would typically see during a regular winter, season.
Wow, that's great. Let's get into the vaccine discussion. First of all, President Biden is saying 100 million shots in 100 days. What's that all about?
Well, I mean, I think it's a great goal. I think it's going to be difficult to get there if we don't see more vaccine production occurring. There is one thing on the horizon, though, that could help us a lot. Johnson & Johnson has a vector vaccine that is nearing completion of data collection, and we would expect that it will go before FDA most likely in February. And if that's the case and they get it approved, then we'll have a third vaccine on the market. One of the interesting things about the Johnson & Johnson vaccine, it's a single dose, so you don't have to get one shot, and it doesn't require the real cold storage that has made it a bit logistically difficult with the Moderna and Pfizer vaccines to distribute those. So that's really good news. It would lend itself to being in doctor's offices, in rural communities, in pharmacies, and other places. And I saw yesterday that Johnson & Johnson had committed to manufacture 100 million doses of their vaccine for the United States. So will we get it done in 100 days? I don't know, but I think we're going to see a lot more vaccine coming out in the near future. And once Johnson & Johnson, then we're going to have 3 vaccines on the market, which will really help.
That's exciting. Okay, Dale Denwalt with Oklahoma is saying that Carnegie Mellon has a daily tracking survey of Facebook users asking about pandemic behaviors and attitudes. Notably, only 68% of Oklahoma respondents said they would take the vaccine if offered to them today. Is that concerning to you? How do you respond to that kind of information?
So the question is about Oklahomans that have said that they would take the vaccine, and the number was 68%. That number is actually up from what it was earlier. Before the Christmas holidays, there were fewer people that were saying they would take the vaccine. I think a lot more people now are gaining comfort as they've seen a lot of people taking the vaccine. I want to point out a couple of things that I think are really important to remember. The first is what our goal is with vaccination is to achieve something called herd immunity, where enough people in the population are immune to COVID-19 that it's very difficult for the virus to find somebody else to infect. In other words, the more people you encounter, fewer of them are actually susceptible. So even if you happen to have the infection, it would be more difficult for you to transmit it from one person to another in the concept of herd immunity. And we don't know exactly what that number is for COVID-19. I've heard numbers anywhere from 70 to 85% of the population needing to have some immunity. But remember, there's 2 ways to develop immunity. We've had a lot of Oklahomans get COVID-19, and it's very likely that many of them have some degree of immunity. Studies have shown now that after infection, you have immunity for at least 6 months, and I think it's likely that as those studies progress, we'll see that immunity lasts longer. There have been more than 300,000 Oklahomans who have had COVID-19 so far, but we know, I was talking with a physician at Integris yesterday, we know that multiple epidemiologic studies have shown that for every person infected that we know about, there may be 4 or 5 more in the community that got the infection that never got sick, never got a test done, or maybe had a sniffles or something, they just never decided to see a physician. So we could have 30 or 40% of Oklahomans that have already had COVID-19 and have some degree of immunity, and now we're adding vaccine on top of that. So remember, we don't have to get to 100% of the population vaccinated to achieve herd immunity. There's 2 ways to get there. One is with natural immunity that's occurred in those people who have already been infected, and then active immunity from giving vaccines. So if we get 68% of Oklahomans to take the vaccine, I think I'd be pretty happy.
So, and that's a Facebook survey, so, that's going to be skewed by the age and the people, the demographics that utilize Facebook. So he was asking about, do you see the non-Facebook demographic, which would be the younger people, more willing to take the vaccine?
So my experience here is completely anecdotal. We've had vaccine clinics now for people 65 years of age and older, and boy, are they lining up to get the vaccine. I think I saw that more than 500,000 Oklahomans who are 65 and older have signed up in the portal to get the vaccine. So I think there's, I think older people who've had vaccines for many, many years, they're used to it. I think they've been quite willing to get the vaccine, and it's such a rewarding experience to be able to give the vaccine to somebody that's 65 or older, because they just feel like they're starting to see some light at the end of that long tunnel. Perhaps they can start to see their grandkids and do those types of things, So I don't know about any specific age differences. My perception is that the older population so far has been very willing to sign up and excited to get the vaccine.
A minute ago you were talking about the Johnson & Johnson vaccine, and Russell of KRMD just texted, what is the estimated effectiveness of that vaccine compared to the mRNA?
Yeah, so some early data was just released, and I haven't looked through all of it. I believe it appears to be very effective in the 80 to 90% range, but I think we're going to know very soon, because they will be developing their data to present to the FDA. I know I heard Anthony Fauci talk about it this week, that he's seen their data and thinks that they're about ready to approach FDA for emergency use authorization. So I feel fairly confident that we'll have a 3rd vaccine on the market reasonably soon.
Okay, so these questions are similar. I think that the only other question is kind of the same vein, is this about that a new report from NPR says pharmaceutical companies are churning out 4.5 million doses of the vaccine a week, but to reach President Biden's goal, they need to crank out 7.5 million doses, and you've kind of spoken to that, but maybe just kind of wrap up.
Yeah, I think, so the question is, can the manufacturers produce enough vaccine so that we can get 100 million doses in 100 days? And again, I think it's a lofty goal, it's a great goal. If we don't achieve it, that's okay. Let's get the vaccines out into people's arms as quickly as possible. For those of us that are giving vaccines, our biggest frustration at the moment is we don't have enough vaccine. We have plenty of capacity to give a lot of shots. We have doctors' offices, pharmacies, and others that want to give shots. We just need to get vaccine to them so they can start to distribute it. So having a 3rd vaccine on the market with a 3rd manufacturer, I don't know if we'll get there in 100 days, but I think we're going to see a whole lot more vaccine come on the market in the relatively near future.
Anything else?
I think that's it. Just again, I'm going to encourage everybody, even though the numbers look better, we can't let down our vigilance right now. Otherwise, we could see uptick in the cases again. We just don't want to go back to where we were.
And that's happened in some other states that had been doing really poorly. They got better, and then it went back.
Our numbers have come down so much in the past 10 days, but we could see that go the other way. And we're going to have to watch very carefully as the schools reopen and other things and see what happens.